You wake up each morning feeling your heart beating quietly in your chest, without knowing what that rhythm is telling you. Your body has been generating a precise cardiovascular report every single night while you slept, and you have never read it. You carry one of the most powerful heart health numbers available anywhere, yet it costs you absolutely nothing to access daily. Your doctor checks this number briefly during appointments, but the real story only reveals itself when you track it every morning yourself. Your resting heart rate right now is either quietly protecting your heart or silently accelerating its biological aging process every day. You could be sitting 10 to 15 beats above the threshold where cardiovascular mortality risk begins climbing sharply and dangerously upward. A resting heart rate above 80 beats per minute carries a 45% higher cardiovascular mortality risk than one below 60.
This video is for educational purposes only and does not replace professional medical advice from your doctor. The resting heart rate is one of the most information-dense numbers your body produces every single minute of your life. It reflects your autonomic nervous system balance, your cardiovascular fitness, your inflammation level, and your stress state simultaneously. The Copenhagen male study followed 2,800 men for 16 years and produced some of the most compelling resting heart rate data available. Measuring this number correctly, consistently, and interpreting it accurately can give you a genuine clinical-grade cardiovascular assessment for free.
Number 7. The baseline protocol. Measure every morning for 14 days. Calculate your average. That number is your cardiovascular signature.
A single resting heart rate measurement is informative. 14 consecutive morning measurements are genuinely clinically powerful data. Biological variability means that any single day may not represent your true resting state due to minor confounding factors. Sleep quality, hydration status, recent alcohol intake, and minor illness all shift the resting heart rate transiently. By averaging 14 measurements, you smooth out the noise and identify the underlying signal, your true autonomic baseline. Record each measurement immediately upon waking before standing, speaking, or reaching for your phone or coffee. Log the date, time, and number in a dedicated notes file or journal that you maintain consistently throughout the year. After 14 days, calculate the simple arithmetic average. This is your personal cardiovascular baseline for the next 30 days. Repeat this 14-day measurement period every 3 months. Track how your baseline shifts in response to your lifestyle choices.
Number 6. Red flags. A sudden unexplained increase of 10 or more beats per minute above your baseline requires immediate medical attention.
Your 14-day baseline is not just a number. It is your personal early warning threshold for detecting biological disruption. A resting heart rate 10 or more beats per minute above your established baseline on consecutive mornings is a clinical alert. This elevation pattern can signal the onset of infection before you feel any other symptoms of illness at all. It can indicate overtraining syndrome in physically active individuals whose recovery systems have been chronically overwhelmed. Medication changes, new supplements, or increased caffeine intake can also drive this pattern and require prompt review. In rare cases, a sustained unexplained elevation signals a cardiac arrhythmia requiring immediate electrocardiographic evaluation by a physician. Do not dismiss persistent elevation as stress alone. Stress must be considered, but it must not be the only consideration. If your resting heart rate remains elevated for 5 or more consecutive days without obvious cause, contact your physician that day.
Number 5. How to lower it. Zone 2 cardio, sleep quality, stress management, and hydration are the 4 primary levers.
The single most powerful intervention for chronically lowering resting heart rate is consistent aerobic exercise at moderate intensity. Zone 2 cardio means exercising at a pace where you can hold a conversation but would not want to sing comfortably. 3 or more months of consistent Zone 2 training produces measurable parasympathetic nervous system adaptation and reduced resting heart rate. Elite endurance athletes achieve resting rates of 35 to 45 beats per minute through decades of dedicated aerobic conditioning. Sleep is the second most powerful lever. Poor sleep quality elevates cortisol and sympathetic tone, raising the resting rate. Chronic psychological stress keeps the sympathetic nervous system in a state of perpetual activation. The heart rate cannot drop fully. Dehydration reduces blood volume. The heart compensates by beating faster to maintain cardiac output and tissue perfusion throughout the body. Reducing alcohol consumption produces measurable resting heart rate reductions within days to weeks of sustained abstinence.
Number 4. The autonomic system. Your resting heart rate reflects the balance between your biological gas pedal and your brake.
The autonomic nervous system controls all bodily functions that operate below conscious awareness and without deliberate voluntary control. The sympathetic branch is the accelerator. It increases heart rate, blood pressure, and metabolic rate in response to perceived threat. The parasympathetic branch is the brake. It slows the heart rate and promotes recovery, digestion, and tissue repair during rest. A healthy resting heart rate reflects strong parasympathetic dominance during the quiet state of early morning waking. When the sympathetic system is chronically overactivated, the resting rate remains elevated even during sleep and complete physical rest. Chronic sympathetic overdrive is associated with accelerated arterial wall stress and progressive atherosclerotic disease over time. Heart rate variability. The beat-to-beat variation in your heart rhythm reflects parasympathetic strength even more sensitively than rate alone. Wearable devices can now measure heart rate variability overnight. This provides an even deeper window into your autonomic nervous system health.
If this information is changing how you monitor your own cardiovascular health, please subscribe and tap the notification bell now. These evidence-based self-monitoring strategies are published weekly, and every single one of them is completely free to apply. Number 3. What raises it? Deconditioning, chronic stress, poor sleep, alcohol, and hidden infection all drive your rate up significantly.
Physical deconditioning is the most common reason for an elevated resting heart rate in adults over the age of 50. When cardiovascular fitness declines, the heart must beat faster at rest to maintain the same cardiac output as before. Chronic psychological stress maintains the sympathetic nervous system in persistent activation. The brake never fully engages during rest. Poor sleep quality, particularly fragmented sleep or insufficient total sleep duration, elevates cortisol and sympathetic nervous system tone significantly. Alcohol consumed the previous evening causes sympathetic rebound activation during the second half of sleep and early morning hours. Subclinical infection, meaning infection too mild to produce obvious symptoms, reliably elevates the resting heart rate by 5 to 15 beats. Smoking accelerates the resting rate through direct nicotinic receptor stimulation and through progressive cardiovascular deconditioning over time. Anytime your resting rate is elevated, systematically review each of these causes before assuming the elevation is without significance.
Number 2. The science. A resting rate above 8 beats per minute carries 45% higher cardiovascular mortality than below 60.
The Copenhagen male study followed 2,800 men for 16 years with comprehensive cardiovascular outcome tracking and documentation. Men with a resting heart rate above 80 beats per minute had a 45% higher cardiovascular mortality than those below 60. This association was independent of physical fitness level, blood pressure, cholesterol, smoking status, and body mass index. The resting heart rate carried its own independent predictive signal above and beyond all other established cardiovascular risk factors. Other large prospective studies have replicated this finding consistently across both male and female populations in multiple countries. A resting rate below 60 beats per minute, achieved through fitness or natural parasympathetic dominance, is associated with protection. The protective effect of a lower resting rate is most clearly seen in the range between 45 and 60 beats per minute. This data transforms a simple pulse measurement from a routine vital sign into a genuine longitudinal cardiovascular risk assessment tool.
Number 1. The correct measurement method. Most people measure their resting heart rate completely wrong and get meaningless results.
Timing is everything. The resting heart rate must be measured immediately upon waking before any movement or stimulation occurs. Do not sit up. Do not check your phone. Do not speak. Measure while you are still lying in your normal sleeping position. Place your index and middle fingers gently on the inside of your wrist, just below the base of your thumb. Feel for the pulse carefully. Once located, count every beat for a full 60 seconds using a clock or watch visible from bed. Do not multiply a 15-second count by 4. This introduces significant mathematical error that undermines your clinical data quality. Count the full 60 seconds every single morning for your baseline protocol. There are no shortcuts in accurate self-monitoring. Smartwatches and fitness trackers are adequate for daily monitoring once your manual baseline has been established and verified accurately. Any watch that measures optical heart rate during sleep will give you overnight average data that is even more clinically accurate.
Your resting heart rate is not just a number on a fitness app. It is a live readout of your cardiovascular aging process. By measuring it correctly, consistently, and interpreting changes intelligently, you gain clinical insight most people pay doctors to provide. The lifestyle interventions that lower your resting rate also lower your risk of heart attack, stroke, and cardiovascular mortality. Place your fingers on your wrist tomorrow morning. Count 60 beats. That number is where your cardiovascular conversation begins today. Subscribe, tap like, drop a comment below. Share this video with someone whose heart health you genuinely care about protecting.